My name is Genoveva Islas, and I am the director of Cultiva, Salud. We are a public health advocacy organization based here in Fresno, California. I am also in full transparency, Fresno Unified School District Board member. So you're absolutely right in terms of the unique position that the Central Valley plays in relation to the food system. We are approximately 1% of the agricultural farmland in the United States, but we produce 25% of all of the table foods for America. So anything that would impair our ability to provide that could be catastrophic for not only California, but potentially for our nation. I also just want to say that when we talk about the experience of farm workers, there is a huge inequity in terms of the resources and supports. I am proud that my farm working community is recognized as essential workers, and those essential workers need essential protections. We have for far too long not had fair and equal pay. We do not have retirement. We do not have access to insurance. And so I want to echo an earlier comment about those communities that are struggling with before COVID, suffering disadvantages. That disadvantage is even more magnified now. In the San Joaquin Valley, which is the region that produces most of our agriculture, we are experiencing about 1,921 cases and 63 deaths. And I know that some would think that there seems to be some type of protective barrier for the San Joaquin Valley. I want us to really think diurnally about this. The San Joaquin Valley does not have a whole lot of international flights that come here. So in some ways, yes, there is that as a protective barrier. We also do not have a very high level of tourism outside from Yosemite. Most people that are in the San Joaquin Valley are people that live in the San Joaquin Valley. However, there is unfortunately an incredible amount of potential risk that we are that need to consider that could really exacerbate the situation. One is that the Central Valley has a very high level of asthma because of the poor air quality. COVID is a respiratory illness, so there would be that as a an exacerbating factor. There is also the issue of very high rates of obesity and diabetes here in the San Joaquin Valley, which we know are also risk factors to having more severe consequences if you happen to become ill. The San Joaquin Valley has consistently suffered from a provider shortage, so we do not have an adequate amount of trained physicians to be able to respond if there is a higher level of outbreak. And equally, we do not have the same sort of resources at our disposal when you think about access to medical care providers or hospitals. Our rural communities would be really challenged to respond to caring for individuals that become sick. So I just want to reiterate that there is a very unique importance to helping to mitigate infection here, as was alluded to earlier. When we cannot farm, we cannot produce food, and that affects all of us. We need to protect our farm workers, and we need to make sure that we are investing in the resources that allow us to produce foods